Under the theme Climate Change, the Environment and Human Health, health and environmental specialists will present their findings on the implications of rising sea levels, the major impact of climate change on food security and health, among other major health issues, so as to provide guidance and assistance to health ministries, says Chief Medical Officer of Guyana, Dr. Shamdeo Prasad.
It's not enough any longer for health ministries to just concentrate on its core function, which is to diagnose and treat illnesses. And we need to really get more and more involved. And we are getting more and more involved in prevention, in working with our partners and other stakeholders, with working with the communities themselves and people in trying to improve their health status.
Dr. Shamdeo Prasad in an exclusive interview with Nightly News about the 62nd Annual Carpha Health Conference at the Guyana Marriott Hotel. He noted that the biggest challenge in Guyana, as well as other Caribbean countries, is the epidemic of non-communicable diseases like diabetes and hypertension, which are the main contributors to untimely deaths.
We still do have some people who would succumb to infectious disease, as you said, leptospirosis, or a few cases of malaria, and in children diarrhea and so on. But the main reasons for untimely, that's even deaths before 60 years old, right? Untimely death is a lot of it related to NCDs, accidents and violence in Guyana. A lot of it related to those. So we need to, start paying attention to some of these.
Dr. Prasad reiterated that the Ministry of Public Health will zero in on non-communicable diseases that are of serious concern, but that the population can help in this fight as well.
Even though the health sector is struggling, sometimes to provide all the medicines and dialysis and everything, and it's becoming more and more costly since the numbers of patients are increasing rapidly. But we would like to shift a little bit more on the prevention side. So even if you do have the disease, and I'm starting there, which is like secondary prevention, you can do a lot of things if you're diabetic, if you're hypertensive, if you have one of these other conditions, to prevent yourself from deteriorating.
Reporting for HGP Nightly News, I am Krsiten Macklingam.